patient.
Okay, I propose a very simple solution for presbyopia. It is very nice to me to be here in Geneva. I would like to thank the organization of Presbymania. Let us begin by considering that accommodation depends on the parasympathetic system to the lens changes. For lens changes is very important the ciliary muscle function. More stimulation, more contraction. For far vision, we need a slight contraction of ciliary muscle. For near vision, we need a strong contraction of ciliary muscle. This is a very important point because we tend to think that the sympathetic system play a role in accommodation, but it's not totally true because sympathetic system play a role in very special situations. For example, totally darkness or big emotions, but not for accommodation. Accommodation depends on the parasympathetic stimulation. Another point very important is there are many receptors, many muscarine receptors in the ciliary muscle. And another point very important is there are a nucleus of accommodation in hypothalamus which regulated the level of acetylcholine. Presbyopia example is a problem which depends of level of acetylcholine. After 40 or after 50 years old, the level of acetylcholine decreases. It's for that we can help accommodation with the stimulation of parasympathetic drugs. That is the princess of this treatment. We use a combination of parasympathetic drugs and non-steroidal drugs because it's necessary the combination for maintain the stimulation in time.
Thank you. I'm sure we will come back to you in a minute or two. I do have some email questions, and the first one is to direct it to Japan again. We have two questions for you. The first one is, when you've finished with Ortho K, can you really freeze the cornea with cross-linking?
Yeah, after finishing Ortho K, you mean, yeah.
After, when you finished with Ortho K, can you manipulate the cornea with cross-linking?
Yes, I think so. Then, because then Ortho K is very reversible technique. So if we finish Ortho K, and maybe after 1 month, it will completely recover the original shape. So after finishing Ortho K, we can do any kinds of operation.
Okay. The second question. Do you have, up to now, any Ortho K lenses which correct presbyopia with a change of asphericity? That is to say, as I understand it, is that you have a lens with an Ortho K procedure with an aspheric, that you obtain an asphericity of the cornea after the ortho-K treatment.
Asphericity.
Yeah,
I see.
asphericity.
The very difficult case for correct the myopia, presbyopia, is the patient with high astigmatism, irregularity of the corneal surface. So some patients complains over astigmatism after ortho-K treatment. So that's the very important thing to solute solute the vision problem with ortho-K treatment, during ortho-K treatment.
Okay,
so
thank you.
better maybe the good design, good movement, and good position. Yeah, ortho-K, the point of ortho-K
then you
is
don't
good,
need really
yeah,
much
movement and position. It will make to reduce such kind of asphericity.
Thank you.
Thank you.
Now, Juan, you have also some fans out there, and the question they ask you is, do you create alternate monovision by treating only one eye?
No. The treatment with the drops are with the both eyes, mainly because the accommodation we have with the both eyes. We need use the drops in both eyes for better results. It's not necessary use the drop in one eye because you didn't lose vision for far vision. In monovision you lost vision for far, but with this kind of drops it's opposite. You sometimes improve the vision of far, and of course improve your vision of near. But you have to study very well the patient. I repeat, it's not for all the presbyopic patients. You have a lot of protocols. You have to follow up very good the patient to have good results.
Right. In this modern age, I also like to hear the panel's view on sex. Do you find any difference between males and females that you have treated? You are allowed to choose any method you like for the treatment, but do you see any difference in the final outcome of that patient? Frank?
Yes, I will discuss my own results and also the results of Magda Rao. She did important studies on that, and again she contributed with the chapter in my book. And then we talk about multifocal lenses. First of all, the satisfaction degree for female patients is higher than for male patients. And why? Because they want to stay younger, they want to be without their glasses, they take the secondary effects. Second, the reading distance is different, and it's not completely linked with physiognomy, because they are taller than men, because I found also a 5 centimeter difference in reading, optimal reading distance. Female patients, they read closer. Another thing is that in her series, she had to explant 10 eyes, 10 multifocal lenses. 9 of the 10 were for male, 1 only for female. And as I said, female patients, they will take the secondary effects easier than male. And last, that's anecdotal. When we operate on patients, we have the same experience. Some male patients will tell you, after cataract, I want to see the young ladies again. I've never heard a female patient say that, I want to see young males again.
Okay. The panel, no, sorry, I'm so sorry, I've just had a sign that we are running out of time. I really do want to thank the panel for the very active participation. I want to thank the audience out there for the patience to listen to us. So from all of us to all of you out there, thank you, and we see you soon again. Bye-bye.